Every other minute, a woman dies during childbirth and prenatal care somewhere in the world. 1 in every 2 women in Nigeria are at risk of dying during pregnancy. It could be you or your relation. It could be anybody. Maternal mortality, also known as maternal death, as defined by World Health Organization, is the death of a woman while pregnant or within 42 days of termination of pregnancy from any cause related to or aggravated by the pregnancy or its management, but not from accidental causes. It has been a major cause of death among women of reproductive age in many countries and a serious public health challenge, especially in developing countries. The maternal mortality ratio represents an obstetric risk. Globally, thousands of women die annually from complications during pregnancy, childbirth, or postpartum period. Maternal death may be due to a lot of factors, ranging from primary medical causes such as unsafe abortion, pre-eclampsia and eclampsia, obstetric hemorrhage, sepsis, and ectopic pregnancy, to secondary causes such as anemia, heart disease, malaria, and respiratory tract illness.
The causes of maternal death can be looked largely into 2 major groups. 1, social causes and medical causes. If a woman develops a medical cause, is living far away from home, and does not report the warning sign early, then it is a contributory factor to the deaths. Then the medical causes too are divided into 2 major groups. Those that arise during the index pregnancy and those that were pre-existing but aggravated by the index pregnancy. Those arising during pregnancy account for about 80% of maternal deaths, whereas those that were pre-existing, like HIV, malaria, anemia, and aggravated by the pregnancy, account for 20%. The 80%, which are due to index pregnancy-related complications, what we call direct obstetric complications, are postpartum hemorrhage, delivery immediately after the birth of the baby. That's the commonest cause of death. Then high blood pressure during pregnancy, labor and delivery. We have ruptured uterus, we have obstructed labor, ectopic pregnancy, this puerperal sepsis. These are conditions that arise during the index pregnancy.
Some of the underlying causes that prevent women from receiving and seeking care during pregnancy and childbirth are poverty, distance to facilities, lack of transportation, use of traditional medication, poor road network, lack of information, inadequate and poor quality services, cultural belief and practices. The fee-paying nature of hospitals with a higher relative cost per service may have compounded the problem.
My challenge is sometimes when you are being given some drugs, if you go to pharmacy, you may not get some. What I need government to do for women is that their delivery and hospital bill should be free for them.
The place is very small, so I'm pleading with government to make this place very comfortable for us. Even as we are sitting here, we are not just comfortable, the place is very choked, and no space, no breeze coming in.
The distance is too far from town to here.
The United Nations Population Fund UNFPA 2007 report indicates that the global maternal mortality rate is equivalent to 1 woman every 2 minutes, and for every woman who dies, 20 to 30 experience complications with serious or lasting consequences. UNFPA estimated that 303,000 women died of pregnancy or childbirth-related causes in 2015. The alarming rate of maternal death has brought about mysterious belief in some women that deaths during pregnancy were caused by spiritual attacks, leading to spiritual coloration of the public health issue.
I want to seduce people's minds concerning issues that whenever they happen, especially medical issues, they will quickly attach it to demonic attacks. Antenatal is very, very important, especially among pregnant women, because failure to go to antenatal clinic, there may be complications with the pregnancy, and this will lead to stillbirth and many other health complications. As a church, we always encourage pregnant women to make sure they attend antenatal frequently.
According to estimates, Nigeria currently has a population of over 180 million with a birth rate of 5.5 births per woman. This is projected to reach 440 million people by 2050 with a growth rate of 3.2% annually. In terms of maternal health, Nigeria health indices are one of the worst worldwide. Nigeria ranks second to India in absolute number of maternal deaths. World Health Organization said in 2010, Nigeria contributed 14% of all global maternal mortality ratio of about 814 per 100,000 live births at 2015. The current estimate in Nigeria, as revealed by the Minister of Health, Dr. Osaje Ehanire, in a meeting with the Association of General and Private Medical Practitioners of Nigeria and Guild of Medical Directors in August 2020. He said Nigeria has 512 maternal mortality per 100,000 births. Now, that's about the worst in the world, due perhaps to COVID-19 that has hit the country in a way that has crippled everything. The maternal deaths occur with varying geographic and regional areas and between urban and rural areas. The northern part of the country generally has worse indicators.
We have been trying to educate, sensitize the women in our domain that they should be going to antenatal when they are pregnant as when due, and they should be going as frequent as possible so that the issue of delivering at the village will stop.
In Nigeria, we used to lose so many women. That's why we advise them to attend the antenatal in the hospital.
Reports from Maternal and Prenatal Death Surveillance Response Committee in Benue State has shown high mortality rate. It showed that 20 maternal deaths, 126 prenatal deaths were recorded in the 23 general hospitals in the state from January to September 2020. Even with those scary statistics, it is still seen as underestimated since assessing the number of maternal deaths accurately has remained a problem because of unavailability of data, especially in environments where most women die at home and on transit. How, therefore, is the State Planning Commission ensuring that all pregnant women are captured for effective planning?
Government has invested considerably in skilling its human resources to provide the care that is needed, in providing the resources that these human resources will use in these facilities, from drugs to non-pharmaceutical products that are required to provide adequate care.
There are some maternal deaths that do occur due to ignorance. We need to apply those. They are preventable deaths if actually we know actually what to do. Those deaths are preventable. So they intervene in such areas. They also build capacity of 33 health workers on modified life-saving skills so that they'll be able to handle delivery safely. There are a lot of programs in the aspect of
The observed rise in mortality may also be due to strike actions by hospital workers, lack of adequate information to women on importance of antenatal care, and reduced government budgetary support for health education and other health services.
The Benue State House of Assembly can create that with the corporation, the ministry, create a budget line for pregnant women. But basically what we have now is the law that established health insurance agency that provide free medical services.
Normally you get population of 50 to 60 pregnant women, 50 to 60 pregnant women that comes before. But this year, since this year, particularly from April to now, the attendance has dropped. We'll get there like 20, 18, 22 like that. Not much again. Because of, to me I'm thinking because of poverty. Because one, this our hospital is situated at North Bank. And most of our clients, if you can get their address, most of them come from the rural areas.
With the already weak health system, from policy formulation and implementation to delivery of services, what is government and partners doing to change the ugly narrative?
We are going to look at upgrading the General Hospital Kasnala and General Hospital Boku, General Hospital Buga, so that if you have consultants, they can serve as an addendum to the tertiary health system. What we need to do is that there should be government will, and they should indicate the interest first, and then the government support will be able to do that.
The government is keen to various policies that can prevent maternal mortality. So this aspect is, it's an issue of we go to reproductive health, family planning, all of that to get towards prevention of maternal mortality. And we also talk of even emergency obstetric care. These are all aspects that.
When the antenatal is high, the time for them to deliver, they move to other places. They don't deliver much in the health facilities, going by the number of the nature of attendance that they have in the antenatal care. And we have noticed this also to be a problem in the state. Where they go, most of the times they end up in the hands of the traditional health attendants.
Maternal mortality reduction remains a priority under Goal 3 of the Sustainable Development Goals, SDGs, which is to ensure healthy lives and promote well-being for all at all ages in the new SDG agenda through 2030. How well will this be achieved remains to be seen. The women of Nigeria certainly need help to overcome this challenge.
We have practically supported the fight against stillbirth and quality maternal health in rural and urban Benue communities since the inception of the Unispring of Life Foundation in May 2016 through our various medical outreaches. In particular, we donated ultrasound scanning machines to Father Matthias Health Facility in Naka and St. Veronica Health Clinic in Ondana, all in West local government. And in that same year, 2019, when the donations were made, we have the report that about 79 persons had access to the scanning services, and we are very sure that that number must have been tripled as we speak. And then in same year 2019, we also sponsored the treatment of over 50 VVF victims in partnership with Equa Hospital Jos and St. Bishop Moray Hospital in Makurdi. And then again, we also carried out awareness and sensitization campaigns on nutritional issues and the importance of assessing health education during pregnancy and after post-delivery periods. I'm very impressed by the efforts demonstrated by UNFPA in the states, particularly the provision of safe space management that has impacted on lives through mentoring and skill acquisition. There are so many testimonies in that regard. UNFPA founded and the foundation implemented the management of safe space in conflict communities like Oba and Abeda in local government. And 503 adolescent girls and young women benefited from that support.
We go, and that is the essence of going out to sensitize them, to tell them that it is better to deliver in the hospital. But some of them, because of lack of funds or resources, they prefer having their babies at home.
Funding has always been a challenge in the past few years.
Even with this target, factors such as poor health-seeking behavior are evident in patterns of booking, delivery by skilled birth attendants, recognition and reporting of warning signs during pregnancies, refusal or non-compliance with medical advice and family, failure of birth attendants to recognize danger signs, failure to accept limitations, also harmful traditional practices, and delays are strong risk factors towards maternal deaths. Therefore, building capacity of the traditional birth attendants becomes imperative.
Badza yochi bashingene maka over kobi tu na shingene miselu etiveti weskive wasiken mis bakaza yotu gbenda kwa odoga ya shingene mana bakumave wasuzaki we kaunago kwane na ha mo wasisi na ma from there ma mola na meto na ma hiu na tui.
With the closeness of primary health care centers to the rural people, strengthening of the health system at that level is key in making appreciable efforts in maternal health.
Where they have capacity to do emergency surveillance sections in case of delay in the labor process. So we have strong linkages. The only problem we have sometimes is when cases are referred, we expect that the receiving hospital, after they have seen a treatment, will send back feedback to the primary health care facilities, and this oftentimes doesn't occur.
To come out of this sad development, all hands must be on deck to address health system failure at each point of services. Timely intervention to patients, knowledge of resuscitation facilities, and obstetric life-saving skills can bring down the rate of deaths associated with childbearing. These life-saving functions of emergency obstetric care are intravenous antibiotics, intravenous oxytocin, intravenous anticonvulsants, manual removal of the placenta, assisted vaginal delivery, removal of retained products of conception, neonatal resuscitation, blood transfusion, and surgery.
We have conditions that could be prevented, and then we have majority that kill the women cannot be prevented. They of course suddenly, but can be detected through the warning sign. And when prompt treatment is initiated, in all, deaths could be averted.
With the availability of these amenities and services, these lifetime risks will be prevented. When, therefore, will the thought of delivery come without anxiety from the pregnant women and her family members? When will this end? On the other hand, the end-SARS protests in some states of Nigeria wouldn't have occurred if youths were properly developed or felt protected. Youths have been defined in various manners. Many have used different descriptions to define a youth. The United Nations Population Fund, UNFPA, defines youth as a period of transition from dependence of childhood to adulthood or independence. However, countries are allowed to define a youth with regards to their peculiarities. Different multilateral agencies and countries have a different age bracket which is considered as a youth. The UNFPA, WHO, and UNICEF define a youth as one between the ages of 15 to 24 years, while the African Youth Charter considers people within the ages of 15 to 35 years as youths. The National Policy on Youth Development in Nigeria considers people within the age bracket of 18 to 35 years as youths. Globally, the youth constitute a major segment of most societies, particularly in developing countries. The Nigerian youth especially is perceived as one that is industrious, sociable, and gregarious. However, they are considered vulnerable in society because of the rapid pace of change they are experiencing at this time in their lives. Advancement in information communication technology has exposed youths to a variety of values and ways of thinking which differ from their elderly counterparts. They are also influenced by tribal sentiments, materialistic and consumetrics, religious and experience-delayed transition to adulthood. They are also faced with the challenges of inadequately equipped tertiary institutions, unemployment, inequality in education, religious fundamentalism, hostage-taking, and militancy. A number of studies in Nigeria have confirmed the high-level susceptibility to violence among the Nigerian youth. While factors predisposing youth to violence slightly differ across regions, a common theme flows through, which include socio-economic factors like unemployment, poverty, and upbringing.
UNFPA has been very useful in terms of targeting vulnerable populations, especially of the young, including those in school and out of school. That has been tremendous indeed.
In the aspect of youth development, we know that they intervene in activities like establishment of 11 youth-friendly centers.
After Nigeria's independence, the government initiated several programs aimed at promoting youth development by shaping their character and behavior, as well as promoting competitive spirit and national integration. Notable among these programs is the formation of youth clubs in secondary and tertiary institutions with the aim of encouraging sporting activities and instilling discipline.
The youth-friendly reproductive health services in the schools are very good idea, and the Benue State government will be ready and eager to have this reproduced in all schools.
This program has also created awareness within the students, and also it has enhanced learning, teaching in the schools. It has also encouraged enrollment in our schools. Most of this program has brought about other students coming, particular schools where the school's program is domiciled.
Regrettably, by the 1990s, these commendable efforts suffered a huge setback due to unfavorable macroeconomic and socio-political environments prevailing in the country. The National Youth Development Policy was also created and designed to advocate for youth and youth development. The policy views youth welfare as vital to the Nigerian nation and its economic development. This policy is seen as a youth participation project versus a project identifying problems and needs. The overall goal of the National Youth Policy is to provide an appropriate framework that will promote the enjoyment of fundamental human rights and protect the health, social, economic, and political well-being of all young men and women in order to enhance their participation in the overall development process and improve their quality of life. The target groups identified for special attention due to their vulnerability and circumstances of living include students in secondary and tertiary institutions, out-of-school youths, unemployed and underemployed youths, youths with disabilities, youths engaged in crime and delinquency, female youths, gifted youths, rural youths, young people living in streets, young men and women living with HIV and AIDS, youths engaged and affected by armed conflict situations, illiterate youths, sex workers, and youths in diaspora. But what is the involvement of Benue State government in making the program accessible to the vulnerable groups?
In July 2019, ESLF, in partnership with UNFPA, implemented a workshop on sexual and reproductive health rights for persons with disabilities in conflict-ridden areas. UNFPA also established the first ever SGBV Counseling Center in Benue State at Polimaka Center.
Similar to this initiative, United Nations Population Fund, UNFPA, has set up 9 youth-friendly centers in secondary schools, tertiary institutions, and health centers in Makurdi, Benue State, as a way of responding to the reproductive health needs and development challenges of young persons. The centers are available in St. Joseph's Secondary School, Nima, Government Model Secondary School, Ekwa Secondary School, and Tilegado Secondary School, North Bank, as well as Benue State University, University of Agriculture, College of Advanced and Professional Studies, now Akawetokula Polytechnic, and Family Support Clinic.
On the part of the UNFPA, we wish that they scale up these youth-friendly centers to cover other LGAs in the state, because these youth-friendly centers are just domiciled in Makurdi, and 11 of them are just in Makurdi. Other LGAs in the state are not part of the process, and just one local government out of 23 local governments in Benue State.
This program has a wide range of benefits to students, their parents, and society, as it has reduced different problems like youth engagement in vices and enhanced sex education.
This COVID-19 period that they were home, they moved from house to house among those of them that are in the BOB together, solving one mathematics or reading biology or something.
My grandchild does not play like other children anymore.
This program has brought so many changes in my home ever before now. My children, the way I train them home, and some schools, like my daughter who was in another school, I have to bring her down to this school just because of that. Morally, they are being taught.
Carry out several activities such as counseling with students on their reproductive health.
As an organization, it's one of our priority areas to see that adolescents and young people access these services.
How well, then, are school managements keen in to make the program work better in their schools?
There is much value to our students. On the area of unwanted pregnancies and the rest of them, we talk to the students, we try to counsel them to consider their future first before any other thing.
They've been providing support to the guidance counseling unit. They have often provided sanitary towels, they've provided disinfectants, they've provided documents to check the students and take information concerning the students' health issues.
The youths make up heterogeneous groups that share 2 different common characteristics in seeking health services. They want to be treated with respect and to be sure that confidentiality is protected.
Whenever you're confused about the subjects allocated to the class you want to go to, when you go to that place, you are being given a guide.
There are a lot of interesting and fascinating things from this program, like the talks we get from rape, sexual abuse. It instills in us a lot.
What interests me is
the way our auntie here take care of us, the way she talk to us like a mother. When you are with her, you can never be scared.
In accessing high-quality sexual and reproductive health services, youths are faced with a wide range of barriers. These include structural, socio-cultural, and individual barriers. The structural barriers has to do with laws and policies requiring parental or partner consent, distance from facilities, cost of services or transportation, the utilization of youth potential, education, health and welfare must be placed on the front burner by the government and organizations at all levels for a reproductive society. Should we allow the younger generation to waste away for lack of care and awareness?